Hi physios, welcome back to our channel. In today's topic, we are going to discuss about the physiotherapy in rehabilitation after myocardial infarction. The role of physiotherapist in the coronary care unit, that is ECU, starts from the first 48 hours. During the acute phase of first 48 hours post MI, the physiotherapist plays a supportive, observational and preventive role. Main goal will be preventing the complications from mobility, that example DVT and pneumonia, deep vein thrombosis, maintain joint and lung function and promote circulation, provide psychological support. Key responsibilities will be patient monitoring, monitoring the HR, BP, RR, SpO2 before, during and after the treatment. Watch for the signs of ischemia, example chest pain, ST changes. Early mobilization starts from the passive to active assisted to active exercise. Begin bed mobility training as tolerated. And chest physiotherapy only if there are retained secretions. Use breathing exercise and incentive spirometry. Patient education, teach energy conservation technique, provide reassurance and reduce the anxiety about movement. And positioning, encourage the upright position, sitting in chair, prevent pressure ulcers and improve ventilation. What are the principles of exercise program formulation for the post-MI after myocardial infarction? Physiotherapist must follow a graded individualized program based on patient's hemodynamic stability and functional capacity. Basic principles will be low intensity, that is gradually to progression exercises. Monitor the vital continuously. Exercise should not provoke the chest pain, arrhythmia or the breathlessness. Book balance, that is RPE or talk test for effort tolerance. Rest is as important as exercise intervals. Number 3, components of exercise program. A bed exercise, day 1 to 2. Ankle pump, heel slides, bridging, arm circles, shoulder shrugs, and gentle deep breathing and splinter coughing. Purpose to maintain the circulation and prevent DVT, improve joint mobility. And B, walking program, day 3 to 5. Starts when the patient is hemodynamically stable, pain-free for 8 to 12 hours, no arrhythmias or dyspnea. Stage 1, sitting in the chair, 10 to 15 minutes. And number 2, standing, marching on spot, 2 to 5 minutes. Number 3, corridor walking flat, 5 to 10 minutes slowly. Number 4, increased walking distance as tolerated within the limits. Monitor vitals before, during and after walking. Number 3, stair climbing after 5 to 7 days. Criteria before starting: HR, it should be 100, BMP at rest, it should be less than. Good tolerance to walking, able to perform ADL without symptoms. Technique, 1 step at a time, hold rail, practice going up and down 4 to 6 steps. Monitor for fatigue, dizziness or chest discomfort. Progression guidelines: increase duration first, then intensity. Follow Carvanen's formula if a stress test is available to set target heart rate. Include cool down and relaxation at end of each session. Contraindications to exercises: uncontrolled arrhythmias or angina, acute heart failure, SBP should be less than 100 mmHg, or DVP should be greater than 100 mmHg. Should also be 100 mmHg. SpO2 greater than 90 percentage at rest. Fever and or the systemic infections. Home exercise program after myocardial infarction. The goal is to improve cardiovascular endurance, prevent deconditioning, promote confidence and independence, encourage a safe return to daily and leisure activities. Sample daily home exercise plan. Warm up to 5 to 10 minutes, shoulder roll, neck rotations, gentle walking, breathing exercise, diaphragmatic pursed lip 2 to 3 times per day. Stretching, 10 minutes, calf stretch, hamstring stretch, back and shoulder stretch. Walking, 15 to 30 minutes. Start with 10 minutes per day, increase gradually, split into sessions if needed. Sit to stand, step up. For leg length, functional mobility, 5 to 10 reps. Cool down 5 minutes. A low paced walking plus breathing, deep breathing. Okay. Intensity monitoring. Use a Bogue rating of perceived exertion, that is rating of perceived exertion, RPE. Aim for 11 to 13, light to somewhat hard. Talk test, should be able to talk but not sing. Monitor HR, BP, SpO2 if possible. Advice on leisure activities. Encourage safe, enjoyable, low impact activities. Recommended or the walk-in park or nature trail. So it will be intense the sports to be avoided. Let's see the recommended part. Walking in the park or nature trail, gardening, yoga, light cycling, swimming post clearance, dancing, low impact styles, family outings and hobbies. To be avoided, intense sports like tennis and squash, lifting heavy weights, long distance running, strenuous trekking or hill climbing, stressful or emotional taxing task. Advice: start short or simple, progress as per tolerance, avoid training, breath holding, and overexertion, maintain hydration, and avoid extreme temperatures. Physiotherapy for complications after MI, chest infections, post MI, especially post surgery. So, the problem is mucus retention due to immobility and shallow breathing. Treatment: breathing exercise, diaphragmatic and segmental, intensive spirometry, percussion and vibration if secretions present, huffing and supported coughing, mobilization and upright positioning, postural drainage if tolerable, cerebral embolism after stroke after MI. Problem with weakness or paralysis, coordination loss, speech and cognitive issues. Treatment: follow neuro-rehabilitation approaches, passive to active assisted to active exercises for affected limbs, balance and coordination training. Gait training with the aids if needed, speech therapy referral if slurred speech, cognitive exercises, occupational therapy for ADL, monitor for cardiovascular exertion limits during neuro rehab. Shoulder hand syndrome, postural or neuropathic pain, post MI problem, painful, swollen, stiff shoulder and hand, complex regional pain syndrome, type 1. Treatment: pain control, moist heat, tense, gentle massage, positioning, arm support in functional position, active assisted exercise, ROM, especially shoulder abduction, flexion, wrist and hand mobility. Desensitization technique, example tapping, textured cloth, prevent contractions, prevent movement within pain-free range. So let's summarize. Complication: chest infection, treatment, breathing technique, airway clearance, early mobility. Cerebral embolism, neuro rehab, range of motion, balance, gait, speech and cognitive therapy. Shoulder hand syndrome or complex regional pain syndrome, type 1, pain relief, positioning, range of motion exercise, desensitization. So that's it. Hope you guys have learned something new today. Keep learning. Happy learning.